The human body is a wonderful machine, a miraculous collection of interdependent organs and systems that all work together. While science and technology have a long way to go to match the complexity and beauty of how the body works, we have developed remarkable ways to help the body when things go wrong, like when kidneys fail. Over 1 million Canadians suffer from kidney disease and related disorders. There are many causes of kidney disease, and every day more than 7 Canadians learn that their kidneys will fail. So you're not alone with this health problem, nor are you without support.
My reaction when I was diagnosed for kidney disease was that I was feeling very angry. I couldn't understand why it was happening to me at this time.
I was just totally devastated, and it was a feeling of fear and hopelessness.
It happened very suddenly for me, especially since I'd been healthy all my life and I was active and everything. And then all of a sudden I realized that I needed dialysis to keep me alive. So it was very difficult, and I was in shock and I was depressed quite a bit. And I was pretty ill, but once I got stable, then things kind of got better.
You'll soon discover that there's a team of healthcare professionals who can help you and your family make informed decisions about your treatment. This team includes nephrologists, doctors who specialize in kidney disease, nurses, dietitians, social workers, and technicians. There are also other people who can help, like peer support volunteers from the Kidney Foundation. Together, we'll help you and your family as you learn to live with kidney disease. There's plenty of help, and there's a lot of hope.
There's the social workers, the physiotherapists, the nurses, the doctors, the dietitians, and that whole team is more than happy to help you with any single problem that you come up with.
There is a lot of support for patients. There is a full healthcare team that is readily available that will help you with all your needs, emotional, practical. You can ask for all the written information. They're there anytime. You simply have to ask.
Yes, your life will change, but you will still be able to continue with some of the activities and pleasures you've always enjoyed. This level of activity will be different for everyone. For the next few minutes, we will explain the function of kidneys and the progression of kidney failure. We'll explore the various treatment options available to you and the choices you'll need to make so that you can have an active and productive life in spite of your failing kidneys. Your kidneys are a very important part of your body. They perform 3 main functions. The main job of the kidneys is to remove wastes from the blood. Kidneys clean about 1 liter of blood every minute. The kidneys also regulate the levels of water and different minerals in your body. Normal kidneys also produce hormones that regulate some body functions. Among other things, these hormones help keep blood pressure in check, regulate the uptake of calcium from the intestine, and help bone marrow make red blood cells, providing you with energy. A special diet and medication may be all that's needed to treat kidney failure in the early stages. The kidneys are so good at doing their job that even diseased kidneys can keep you fairly healthy for a long time. During this period, it's very important that you follow your diet and maintain good blood pressure control. People may go on for many years without needing other forms of treatment. As your disease progresses, waste products and excess fluid build up in your blood. You may feel tired, itchy, or have difficulty sleeping. Serious problems may occur because of high blood pressure, anemia, or the increase in acid or potassium levels in the blood. Symptoms may become very severe, including shortness of breath, nausea, vomiting, and headaches. As you reach the end stage of your kidney function, there are different treatment options available. Treatment options open to you will depend on what is available in your community and on which options are most appropriate to address your particular needs. One option is called dialysis, where wastes and excess fluid are filtered out of the blood and removed from the body, work that the kidneys would normally do. It's important to remember that dialysis is a treatment, not a cure, and that it only replaces one function of the kidney, removing wastes and fluid. To regulate minerals and produce hormones, you will need to take medications. Transplantation is another treatment option. Like dialysis, it's not a cure. A kidney from another person is placed in your body to perform all the jobs your own kidneys used to do. There are times when people choose not to have dialysis or a transplant. If you make this choice, we'll be here to support and care for you. However, without dialysis or a transplant, the buildup of wastes in your body will eventually be fatal. In any case, remember, experienced, caring health professionals are available to help you make these decisions. It's important to discuss all the options, their strengths and limitations, and come up with the best choice for your situation and needs.
I would like to suggest to all the patients that are experiencing kidney failure to seek out, to find out all the information pertaining to the condition, to find out what their options are, and to be actively involved in the maintenance, in the care of their health.
When you know you have the disease, you should go to your healthcare team at the earliest opportunity. And with their assistance and their guidance, you will find that you'll be able to cope with the disease much better.
Dialysis involves artificially removing the wastes and excess fluid from the blood. There are two types of dialysis: hemodialysis and peritoneal dialysis. During hemodialysis, your blood is circulated through the hemodialysis machine, where it is filtered and the wastes and excess fluid removed. The blood is then returned to your bloodstream. There are several ways to gain access to your bloodstream. An internal fistula is the most commonly used method, where an artery and vein in your arm are surgically connected together. The enlarged vein is then used as an access site for inserting needles to connect you to the dialysis machine. An internal graft is another common way of providing access, where a short piece of special tubing is placed under the skin to connect an artery and a vein. This graft is used as the site for inserting needles for hemodialysis. When the veins in the arms and legs are too small to provide enough blood, or when access to the blood is needed quickly, temporary access might be made through a blood vessel near your collarbone until a permanent site is ready. Depending on your community, there are several places where hemodialysis can be performed, such as hospitals, self-care centers, which are associated with hospitals, where you are trained to participate in the treatment process according to your own level of ability, with some help from nurses and technicians. You may use community facilities at a convenient location close to your home. Here, you are encouraged to be as independent as possible, participating in the treatment process with support from experienced health professionals. Or you may perform the treatment at home, where, with special training for you and a companion or nurse, you can maintain your independence by taking care of the hemodialysis yourself.
You know, you come in with a lot of fluid on, a lot of toxins in, and after you've dialyzed, it's almost like a complete load off your entire body because you're clean now.
I feel that hemodialysis is a good choice for me because I have to go to the hospital 3 times a week and 3 hours each time. So that leaves me enough time to care for my child and do various other activities.
Somewhere along the line, a drug by the name of EPO came along, and it has just done miracles to people that are on dialysis, especially myself. I thought I was doing great before it came, or EPO came, and after it came, I believe that it just improved my lifestyle threefold. The energy I had to start gardening again, going for walks again, being able to go out fishing again, in a limited degree, of course, but still with a lot more energy than I ever thought I could have.
I have to take care of my diet, avoiding some things while taking care of what's good for me and what is not. So I always have to watch what I eat and plan my diet accordingly.
Some of the benefits to hemodialysis to me have been just my way of life. I feel I owe all my life to dialysis. Without it, I wouldn't be here, and I feel very strongly about that.
Peritoneal dialysis is another type of dialysis which removes the excess fluid and wastes from your body. This type of dialysis uses the lining of your abdomen, the peritoneal membrane, to clean your blood. In peritoneal dialysis, a permanent tube or catheter is inserted in your abdomen just below the navel. A special dialysis fluid enters the abdomen through this tube. Fluid and wastes pass from the tiny blood vessels in the peritoneal membrane into the dialysis fluid. After several hours, the dialysis fluid is drained from your abdomen and discarded, taking the excess fluid and wastes from your blood with it. This process is then repeated at regular intervals. There are different ways to do peritoneal dialysis. One is called continuous ambulatory peritoneal dialysis, or CAPD. It's called continuous because the special solution is always at work filtering your blood. Ambulatory means you are not attached to a machine to perform the dialysis, so you can do it just about anywhere. At regular intervals, usually about 4 times each day, the fluid is drained and replaced with fresh solution, a job that takes about 30 minutes.
The benefits of peritoneal dialysis for me are mostly the fact that I don't have to depend on the hospital schedule. I do things according to my own schedule, so I have to fit in 4 exchanges a day. I revolve it around my schedule, which is very practical.
When I started on the peritoneal dialysis, things changed dramatically. There was so much difference between the certain items that occurred and happened before I went on dialysis, such as the tiredness. I couldn't do more than 10 minutes work without resting for 15. And once I started on the dialysis, my energy seemed to return. One of the nice things about traveling and using the dialysis system is that no matter where you travel to, anywhere in the world, the supplies of dialysis fluid are shipped there for you. You will find them waiting for you. You have to arrange for it, of course, before you go.
The initiation of treatment for me at the beginning was quite difficult, and it was difficult for me to adapt. So at the beginning, I didn't do as many things as I would like to have done. And I have to admit that my energy level just dropped to half, and so I couldn't do as many sports that I like to do. So now, looking back, I'm doing quite a bit of sports that I was doing before I was diagnosed with kidney disease. I'm just limited in my strength and my endurance. And also where I can't just take off in the middle of nowhere. I always have my dialysis to think about. But in general, if I think about what I want to do, I put my mind to it, I can accomplish it.
Another type of peritoneal dialysis is called continuous cycling peritoneal dialysis. This treatment is very similar to CAPD, except that the filling and draining of the peritoneal cavity is done by a cycler machine automatically and continuously during the night while you sleep.
I'm on a cycler CCPD, and I find it gives me a lot of freedom during the day, and the benefit of it is that it has rejuvenated me since I've had this disease, and my appetite has very much improved, and my energy level has increased, and I'm able to return to work. The limitation of the CCPD is that I have to follow a rigid schedule. I have to be hooked up to the machine by 8 o'clock at night so that I could get up and be in time for work at 6 in the morning. There is no restriction to my diet. However, even though the CCPD is a portable machine, when you have to travel, you must plan way in advance.
A third type of peritoneal dialysis is intermittent peritoneal dialysis. This is usually performed in a hospital and involves frequent exchanging of the special fluid in the peritoneal cavity. It means spending 2 or 3 days each week in the hospital. Transplantation is another treatment option. There are 2 basic types of kidney transplants. In a living donor transplant, the donor is usually a member of your family. It could be a son, a daughter, parent, brother, sister, or in some cases, it could be a spouse, a friend, or a more distant relative. After extensive testing of both donor and recipient, if the donor is found compatible, a convenient time is organized for the transplant. Living donor transplants have very good success rates, and there are few risks to healthy donors.
When my family was tested, my mom, my dad, and my sister were the one that matched with me. And my sister was only a half a match. My mom and dad were a perfect match. And physically, my mom is stronger than my father. So my father and mother decided that my mom was going to be my match.
A living-related transplant is the best way to go simply because if a family member is willing to donate a kidney, then it leaves a kidney from someone who has died available for those people who don't have a living donor. And also, if you have a living-related transplant, then you know exactly when the surgery is going to be, and that causes a lot less stress.
I received a kidney from my sister. Having received a kidney from a living-related donor has been a great experience. It's been very positive, and it also has created a greater bond between the 2 of us.
Receiving a kidney from your family is the most beautiful gift they can give you.
If a person does not have a compatible living donor, then they may be added to the cadaveric transplant waiting list. In a cadaveric transplant, the kidney has been recovered from someone who has died suddenly. Consent for organ donation is given by the next of kin.
I recently just had a kidney transplant 4 months ago. While I was waiting on the list, I see a lot of my friends who's being on dialysis with me get transplanted a lot sooner than I was. And then while I'm still waiting, I was never getting a call. And so it was frustrating for me to wait it for 3 years.
I was on CAPD for 8 years when I finally made this decision to go on the transplant list. It was relatively short for me. I realize it's an unusual circumstance. Most people, or some people, wait longer. So it was anxiety-free, more or less. Everything went very smoothly.
Tests are performed to determine compatibility. These include blood typing, tissue typing, and cross-matching. These tests are designed to find the most compatible kidney for you. Transplant surgery takes approximately 2 to 4 hours. During this time, the new kidney and ureter are placed in the lower part of the abdomen near the groin and attached to the blood vessels in the bladder. A temporary catheter is placed in the bladder for a few days to drain the urine made by the transplanted kidney. Fluids and medications are given through special intravenous lines, often placed in the arm and neck. After the transplant, the patient receives anti-rejection medicine and specialized nursing care. The transplanted kidney may not work immediately, and dialysis may be necessary until the kidney begins to function on its own. Rejection episodes are quite common during the first 3 months, and they can usually be treated successfully with medication. Because the transplanted kidney is foreign to the body, anti-rejection drugs must be taken for the rest of the transplanted kidney's life. There are a number of side effects associated with the anti-rejection medications. There is no guarantee as to how long the transplanted kidney will work, and you may have to go back to dialysis if your kidney fails.
The kidney transplant organization was excellent. I mean, my mom felt great and I felt great. Right after we got our transplant, they took care of us very well.
There are quite a few physical and emotional benefits to the transplant. I feel that the physical benefits are amazing. This is the healthiest 10 years I've ever had in my entire life, and there's nothing that stops me. And it's the same with all the other transplantees I know. We've got a second chance to live, and we just go for it.
The limitation of transplant are a few for me. They are to take my medicine for the rest of my life, and also the side effect of it are disappearing every day to the point where I hardly have any.
There are side effects to the anti-rejection medications, and they vary from person to person. It may be acne for some, hair growth, it can be hypertension. For me personally, I'm experiencing some hair loss. Initially, there's a bit of hand tremors, but they subside with time and with the decrease in medication.
After transplant, the limitations compared to benefits are nothing, because only thing you have to do is take your medication on time, have your blood works done, and keep your appointments with the hospital. And with appointments, as the time goes by, they come further apart, so life becomes a little easier.
It takes time to accept that you have kidney failure and to adjust to the impact it has on your life. You're going to need the help and understanding of your healthcare team, your family, and friends. It may help to talk to your social worker, who can provide support to you and your family in adjusting emotionally, as well as assist you with practical problems and the use of appropriate community resources. When your kidneys are not working well, diet becomes an important part of your care. Your dietitian will work with you to plan a way of eating that will provide all the nutrition your body needs, while cutting down the kidney's workload and controlling the buildup of food wastes. It's important to remember that you're not alone as you try to live with kidney disease. There are people available to help you, to answer medical questions, to advise you on appropriate treatment, to find the resources you need, and to listen to your concerns. The Kidney Foundation of Canada offers a wide range of support services, including educational, recreational, and financial services.
I went regularly to the chapter meetings, and one of the reasons for me to go to the meetings was to find out how people were coping with their experience of dialysis, and I found out that people were doing very well and were functioning normally, and that was reassuring for me.
My participation with the Kidney Foundation has been fundraising, peanut sales, and also the application for the Medicalert bracelet.
It's helped me a lot in many ways. meeting patients has helped me cope with kidney disease, and also getting active in the community in trying to promote all sorts of different things that the Kidney Foundation does has really helped me in a lot of ways. And it's been very good place for resources and for me to get information about kidney disease.
There are people like myself who love to counsel our own peers, and I feel that because I've experienced it, I can really speak about it in detail and with a lot of feeling.
Peer support volunteers are people who have had treatment for end-stage renal disease and are specially trained to help others adapt to kidney disease. You can talk to the staff and volunteers in the branch or chapter nearest you about the services available in your area. Living with kidney disease can sometimes be difficult, and it certainly requires a period of adjustment. Yes, your life will be different, but with the strong network of support that exists for you and your family, you'll be able to do many of the things you did before. You have to decide that you're ready, willing, and able to take responsibility for your own health and to follow the plan that you and your family develop with the healthcare team. It's your choice.
I think the best way for someone to cope with renal disease is to have a positive attitude. And I really believe that if you wake up every morning and you feel, yes, I can overcome this, yes, the day is going to be better, I really think you have a head start, because it really is mind over matter.
Live as best you can with what talents, energy, abilities you may have. And remember that it's a beautiful world and much is still possible.
You should not let it get you down, whatever you do. Because as long as there are treatments, there are people to help you.
Just because you have kidney disease doesn't mean you can't do the things you want to do and accomplish the dreams you want to accomplish. So I tell people, you know, you have a goal, you want to do something, put your mind to it and you'll accomplish it, even though you have kidney disease.